Hey everyone, Dr. Nate Lighthizer here from the Oklahoma College of Optometry, talking with you today about the photopic negative response. More specifically, what is the PhNR? When is it indicated? What is it utilized? How do you interpret the reports? And specifically, why does the report on the RETeval for the photopic negative response look a little bit different than some of our other tests that we're used to, like the DR score, the 16 flicker, the flicker 16, things like that. So when it comes to the photopic negative response, remember your different waves of the ERG, the A wave, the B wave, and the photopic negative response. The A wave comes from the photoreceptors primarily. The B wave comes from the midretinal layers, like the bipolar cells, and the photopic negative response is generated by the ganglion cells. So you all know that when we're looking at ganglion cell disorders and optic nerve disorders, it's important to look at that ganglion cell response. And we do this with both structure and function. We look at ganglion cell structure with OCTs. A lot of us do ganglion cell analysis. That gives us a great picture of ganglion cell structure. To get a great picture of ganglion cell function, we look at the photopic negative response. It is utilized by getting that RETeval ERG, a photopic negative response protocol, and that will help in ganglion cell disorders and optic nerve disorders. And when looking at the ERG parameters on the RETeval, when I'm doing a photopic negative response, the first thing that I look at and evaluate is the W ratio. The W ratio is a ratio that's derived from all of those components that I just discussed on the ERG, the A wave, the B wave, and the photopic negative response. And there's a ratio for that. What you want to remember is it's really a comparison between the B wave to photopic negative response compared to the B wave to the A wave. Now, remember that the ganglion cell response is really shown in the photopic negative response amplitude. As that decreases, as that does this, and this response declines, notice that this distance is getting less, which is the numerator. If a numerator in a fraction gets less, the ratio goes down. Take home point, as the W ratio, as that value goes down, that is starting to show dysfunction. The number that I remember when you compare it to an age-matched reference database is 11% or less. If the W ratio is 11% or less, that is indicating dysfunction. It's because, again, this response is getting less, and therefore this arrow right here, this distance is getting less. The numerator is declining, which takes our ratio down 11% or less. The other thing that I look at is the B wave time. And I'm looking at the time of how quickly is that B wave happening. And I want it to be the quicker, the better. The quicker, the better. The smaller the number, the better, because this is a time. The quicker, the better. When you compare it and put it in an age match reference database, I want this to be the lower the number, the better. If it's 89% or higher, that indicates dysfunction. So this B time, I'm looking at this circle here, here, and here. If this percentage is 89% or higher, that should be calling your attention, red flag, that we have got issues with this photopic negative response. And obviously, the one that's been flagged here in kind of teal or light blue here is the one that's abnormal. Look at it, 92%. It's showing a slow B wave time, which is abnormal. Back to the W ratio. Again, what did we say? 11% or less. So we've got one that's within the normal range, borderline, but close, still okay. And then this one that's flagged here in this blue color would be showing a W ratio that is abnormal. So the photopic negative response, again, clinical utility in glaucoma. Remember, if the B wave time is greater than or equal to 89%, that's red flagging you. Or if the W ratio is less than or equal to 11%, that is red flagging you. So use the photopic negative response in your patients, glaucoma suspects, early glaucoma through late glaucoma, and it will give you more utilization, functional data of those ganglion cells.